So the next thing we're going to be talking about is dental basics. So this is on chapter 2 of your dental administrative dental assistant textbook, and it starts on page 16. And some of the things we'll be discussing in chapter 2 are listing the various areas of the dental office and explain the design and functions of each area. We'll label the basic structures of the face and oral cavity, including the basic anatomical structures and tissues of the teeth. We'll label the primary and permanent dentition using the universal, the international, and Palmer numbering systems. We'll chart dental conditions using an anatomic, geometric, and electronic charting system, and listen to describe the basic dental procedures. So I really like this chapter because it really gets to the nitty gritty of dentistry, basically how the day will flow, where the patients will go, the layout of the whole office. Here we go. The administrative dental assistant has a unique opportunity to communicate in several languages. Patients are often unwilling or unable to ask the dentist questions directly. So a lot of times they want to, they may feel comfortable or they may feel more comfortable talking to you as somebody that works in the dental office, but isn't necessarily somebody that's taking their money or has a high-speed drill or a needle in their hand. So a lot of the times you're going to be the person that the patient is more willing to talk to and ask questions. So if you're unable to understand the dental language, it will be difficult to be effective at your job. Effective communication is promoted by an understanding of the language that is spoken by all diverse professionals and patients with whom you interact with on a daily basis. So this is things like making sure you call, you use the right terminology when appropriate. For example, we don't call instruments tools. We don't call them utensils. Tools are found in the garage, utensils are found in the kitchen, but instruments are what are found in the dental office. So it's going to be really important that you use the correct language and the correct terminology when speaking to patients, unless it's a child or somebody you're trying to use layman's terms with. So the basic dental office design includes non-clinical and clinical areas. With the reception area, this is the area that the patient sees for the first time. The business office and administration area is usually opens, so the reception area usually opens into the business office, and most of the duties of the administrative dental assistant are carried out in this area. When privacy is needed, such as when one is interviewing patients or establishing financial agreements or speaking with patients about private matters, an area like the consultation area is perfect for that. The doctor's private office provides space in an area where the dentist can work quietly. The staff room is an area set aside for the exclusive use of the staff, and this can be used for a lunchroom or a meeting area or break area. Additional non-clinical areas include areas for record and supply storage. These areas often include storage shelves and large file cabinets. Clinical areas include treatment rooms, and treatment rooms may also be referred to as operatories. This is where the dental chair is located, the suction, the hand pieces, all the things where we actually do dentistry. In the sterilization area, contaminated instruments are cleaned, packaged, and sterilized. And the dental laboratory area, this may be used for basic laboratory functions like fabricating trays used for bleaching, preparing diagnostic casts, and pouring models. Additional clinical areas include the radiology and imaging area. This usually is where the x-ray room is, where you have different x-ray machines. It could be the intraoral x-ray machines or the extraoral x-ray machines like the panoramic x-ray or cephalometric x-ray. The patient education room is used and designed for use in patient education and motivation. So this is where pamphlets can be shown to the patients, models of teeth or different restorative procedures or videos. So these are the basic structures of the oral or the face and the oral cavity. We have the skull, which is made up of 2 sections. The cranium consists of 8 bones that form the protective structures of the brain, and the face consists of 14 bones. The oral cavity, is another word for the mouth. This is the anatomical area where dentistry is performed. With the lips and cheeks, the lips surround the opening to the oral cavity. The corners of the mouth where the upper and lower lips meet are the commissures. And there are different terms such as the vermilion border, the mucous membrane, the buccal vestibule, and the labial vestibule that are shown in more detail in your book as you do your reading. The frenum, plural for frenum is frena, is a strip of tissue that connects two structures. The tongue, which is covered with taste buds, is a strong muscle that aids in the digestive processes and contributes to speech formation. The salivary glands produce saliva, which provides moisture for the mucous membranes. It lubricates the food, it cleans the teeth, it supplies an enzyme such as amylase that begins the digestive process. The hard palate or roof of the mouth is covered with masticatory mucosa. The soft palate is the posterior continuation of the hard palate. So this is past your throat, past the roof of your mouth where the bone kind of disappears and it turns into soft tissue. The oral mucosa is the tissue that lines the oral cavity. So there are two types of oral mucosa. There are the lining and the masticatory mucosa, and then there is a gingiva. Plural for gingiva is gingivae. This is the term that refers to the masticatory mucosa, which is the tissue that surrounds the teeth, otherwise known as gum tissue. So the oral mucosa has two different parts. There is the lining mucosa and the masticatory mucosa. The lining mucosa covers the cheeks, the lips, the vestibule, the ventral surface, which is the underside of the tongue, and the soft palate. The masticatory mucosa is much thicker and denser and is attached tightly to bone. It is designed to resist the pressure of chewing food and is not easily injured. This type of tissue forms the gums, the hard palate, and the top of the tongue, which is also known as a dorsum. Some basic anatomical structures of the tissues of the teeth include the crown. The crown of the tooth is covered with enamel. Then we have the cervix of the tooth, which is the neck of the tooth, and it's the narrow portion of the tooth at which the tooth and the crown meet. And then there is the root. The root is covered by a thin, hard shell called the cementum. Tissues of the tooth include the enamel, and the enamel is actually a mineralized substance and happens to be the hardest substance on the body. The bulk of the tooth is made up of dentin. This is a living cellular substance similar in structure to bone, but it's softer than the hard outer shell of the crown, which is the enamel, and the covering of the root surface, which is the cementum. The periodontal ligament are connective fibers that help to hold the tooth in the alveolar socket while providing protection and nourishment for it. So this is what the teeth are actually held in place to the bone with. You can think of them as little shock absorbers for the teeth. And this is why your teeth are able to just slightly move a little bit, is because they're not really cemented into bone like we would think. Instead, we have these little shock absorbers, our periodontal ligaments, that kind of anchor your teeth into place. In the center of the crown is the pulp chamber. Within the pulp chamber is a pulpal tissue, which is composed of connective tissue, blood vessels, and nerves. The apical foramen are where the blood vessels and nerves enter through the tooth, which is at the tip of the root. And the pulp cavity is the center of the tooth where the nerve and inner structures of the soft inner structures of the tooth live. Next, we have dental arches. So the mouth is divided up into sections. Okay, so we think of the top and the lower section as like different halves of the mouth. The maxillary arch is known as the upper arch. The mandibular arch is the lower arch or the lower jaw. Next, we have quadrants. With quadrants, the mouth is divided up into 4 sections. The maxillary right, which is the upper right. The maxillary left, which is the upper left. The mandibular left, which is the lower left. And the mandibular right, which is the lower right. Now, I just wanted to know, and you'll want to remember this throughout your dental assisting program, anytime we talk about right or left, we're always talking about right or left in terms of the patient's perspective. So it will always be the patient's left or the patient's right. We will never talk about left or right from your perspective. If you keep that rule or that rule of thumb, you can always, it'll make your life easier knowing exactly where in the mouth we're talking about. There are sextants where the tooth are divided. This is where the mouth, not the tooth, the mouth. This is where the mouth is divided into 6 sections. So we have the maxillary right posterior, or the upper right back teeth, the maxillary anterior, which is the center or the front top teeth, the maxillary left posterior, which is the upper left back teeth. Then we have the mandibular left posterior, which is the lower left back teeth, the mandibular anterior, which is the lower front teeth, and the mandibular right posterior, which is the lower right back teeth. Occlusion is a relationship between the maxillary arch and the mandibular arch in terms of the way they meet or touch. In a perfect occlusion or perfect bite, the teeth meet at specific contact points. If the patient has malocclusion or a traumatic bite, the teeth are out of alignment or occlusion. These here are types of teeth. So these we have primary teeth, which are another term for baby teeth or deciduous teeth. There happens to be 20 primary teeth in the human mouth. Permanent teeth are the teeth that we get after our baby teeth fall out. There are 32 permanent teeth in the human mouth. The anterior teeth refers to teeth that include the canines and forward. So any teeth that happens to include the canine teeth and any teeth in front of those are the anterior teeth. The posterior teeth are the back teeth. So these are any teeth behind the canine teeth and back. Each tooth is divided into sections called surfaces. Now, with surfaces, I'll actually go on to the next slide here. We have proximal. We'll start off with that. Proximal refers to the surfaces that are adjacent to or next to another surface of a tooth. Interproximal is a space created by 2 proximal surfaces, so in between 2 teeth. Mesial refers to the proximal surface that is facing toward the midline. So if you were to draw an imaginary line vertically, right between the eyebrows, between the forehead that runs vertically down to the chin, right in the center of the face, that is the midline. So anything that is closest, or any surface that is closest to the midline, is known as a mesial. Distal refers to the proximal surface that faces away from the midline. So if you have, let's talk about the canine, for example. If the canine has 2 interproximal surfaces, right? We have one in front of the canine and then one in back of the canine. Well, the proximal surface in front of the canine is known as mesial. The proximal surface behind the canine is known as distal. And this can be true of any tooth in the mouth. Buccal refers to the surface of the posterior teeth that face or touch the cheeks. Lingual refers to the surface of the teeth that face the tongue or the inside of the mouth. Occlusal refers to the broad, flat chewing surfaces of the posterior teeth. Incisal refers to the sharp cutting edge of the anterior teeth. So I just want to point out that posterior teeth do not have incisal edges. Instead, they have an occlusal surface. And likewise, anterior teeth do not have occlusal surfaces. Instead, they have an incisal or sharp cutting edge. Labial refers to the surfaces of the anterior teeth that face or touch the lips. And facial, it can be an interchangeable term to describe the buccal and labial surfaces. So now talking about numbering systems. So there's 3 different numbering systems that we will kind of go over. The one that is mostly used, especially in the United States and especially for general dentistry, is a universal or national numbering system. So with this, the teeth are numbered from 1 through 32. And you can actually find a chart of how these teeth are numbered on page 29. This is figure 2-20. And just note on this figure that tooth number one, if you were to think about a clock superimposed on top of this chart, tooth number one would be somewhere around 9 o'clock. And then it goes clockwise from 1 to 16 all the way around. And then from 17 to 32, it continues in a clockwise fashion. And that's how teeth are numbered with the universal system. Okay, primary teeth are numbered very much the same, but instead of using numbers, the primary teeth use letters. So for example, for children, the first primary tooth would be A, and it would be labeled in a clockwise manner from A through J for the top arch, and then it would continue on a lower arch from letters K through T. The International Standards Organization designation system is also known the Federation Dentaire. With this system, we have, and we can see a picture of how the system works also on page 29 on figure 2-21. And with this, instead of numbering the teeth from 1 through 32, they actually start the numbering system at the midline instead of like at 9 o'clock, how we would see it in the universal system. So with this one, the teeth start on the midline and they go down posteriorly. And it all depends on what quadrant we're talking about. So if we're talking about, let's say the patient's upper right quadrant, for example, this is quadrant be permanent 1. So if we're talking about the central incisor, which is labeled 1 here in the diagram, that would be tooth 11 because we place the 1 first, which designates the quadrant we're talking about, plus the number of the tooth, which is 1. If we're talking about the patient's upper right lateral incisor, which looks like number 2 here, it would actually be called 12. This is because we'll place the number 1 that designates the quadrant, and then the number 2 that designates which tooth in that quadrant. So tooth number 12 will know exactly which quadrant and which tooth. So this can be applied to any quadrant in the mouth, where the upper left quadrant would be 2, the lower left quadrant would be quadrant 3, and the lower right quadrant would be quadrant 4. This continues with primary teeth. So with primary teeth, the upper right quadrant would be primary 5. The upper left primary tooth would start with primary 6, and then go on to 7 and 8. So for example, if we're talking about tooth number 85, we're talking about baby teeth. Why? This is because primary 8 designates the lower right tooth. And if we are talking that, with that, we're talking about the child's second primary molar. So 85 would be that very last tooth for that for the primary teeth. The next one we have is the symbolic numbering system. This is also known as the Palmer system. So with this system, each tooth in a quadrant is assigned a number, and quadrants are differentiated by a symbol. So we can see these on page number 29 on figure 2-22. We see these little boxes or little half boxes that go around each tooth. You would designate which quadrant we're talking about. It's very similar to the International Standards Organization designation system, where we will start the tooth numbering at the center or the midline of the mouth, and then we'll work our way down posteriorly, where the most posterior tooth would be labeled 8. So with this one, instead of designating the quadrant with a number, we instead designate it with a symbol. So depending on where, what quadrant we're talking about, tooth number 3 with the box around the, it kind of goes around the lower and the right section of number 3. That's talking about the patient's upper right. So just looking at that chart, you can kind of see where the different boxes are drawn on each number, and then you'll be able to figure out which quadrant it is. Talking about charting methods, there are 2 different types of charts that are used to record dental conditions. One is the anatomic chart, which uses an anatomical representation of the teeth with dental arches, and the other is a geometric chart. And this one we use circles that represent the teeth and which And the circles are divided, which help to designate which sections of the tooth are represented. There's also color coding where, for example, if something is charted in red, this usually means that the conditions require treatment. This can be dental caries or decay. It can mean that the tooth needs to be extracted. It can mean that the tooth is impacted, or an existing restoration that must be replaced, or a root canal that must be done. So these are always drawn in red. The next one is blue. So if we have blue in the chart, that usually means, and this all depends on whatever system your office is using, but blue usually means that there are existing restorations that were done in a different office. So if we see a new patient and we take x-rays and we see that they have crowns, fillings, root canals, we'll mark those very much like how we would mark any type of restoration, but instead we would use the color blue. And that indicates that that is an existing restoration that doesn't need treatment. It's fine. There's nothing wrong with it. If something is charted in green, for example, and this isn't always the case across the board. Every office uses a different system that might have a different chart. But let's say this office uses green to denote restorations that were completed in the office. So if a patient had cavities on a certain tooth that used to be marked in red, once we actually fix that cavity and put a filling in there, that chart would be, or that marking would be turned to green. Oh, also charting symbols. I'm like, there's something that I forgot to say. So with charting symbols, information is recorded on the dental chart with a combination of symbols and color. So unlike the numbering system, which has been standardized, charting conventions still vary widely among practices. So it's going to be necessary for all members of the dental healthcare team to follow a standardized method of charting within their own practice to ensure consistency. So if you look on page 32, we see different markings and symbols that can mean different things. For example, if we look on, let's see if I can make an example out of one of these. Okay, so if we look on the very top chart, which is an anatomical chart, we see that tooth number 2, which is on the upper left quadrant, on the patient's upper right quadrant, tooth number 2, it has a red symbol or red marking that sort of goes from the occlusal surface and it shades more towards the front, indicating that there is an occlusal mesial surface that needs to be treated. Okay, on the very bottom of the chart, we can see that same number 2 tooth instead has like a half H drawn. So there are different symbols that mean different things. Just to note that all 3 of these charts, they all have the exact same treatment noted, whether it's treatment that needs to be done, treatment that's been completed, but you can note the differences in the way each marking is made. The dental procedures that you should be familiar with include the following. So we have a basic and preventative procedure, and this will include an initial examination and prophylaxis, which is usually just a regular cleaning. We have restorative procedures that indicate or include restorative dentistry, like amalgam restorations or resin-based composite white fillings, cast crown restorations. These are also known as caps that are placed over teeth if the structure of the tooth is too deteriorated to hold filling. We have prosthetic procedures that include fixed prosthetics like bridges or implants. We have removable prosthetics like full or partial dentures. Full dentures would be indicated for patients that have no teeth on any specific arch. We have surgical procedures that include simple extractions. With simple extractions, this usually involves the removal of 1 or more teeth without the need to remove any bone or cut any tissue. Surgical extractions are more involved and include the cutting of the tissue and possible removal of bone to facilitate the removal of the tooth. We have endodontic procedures that have to deal with root canals. And then other common procedures like a sealant application, which is a procedure that is done to cover the chewing surface of the tooth with a thin coating of resin. And this is to seal and protect the tooth from the effects of acid attacks, which cause demineralization of the enamel, which can lead to carious lesions like decay or cavities. With basic chairside dental assisting, this will include seating and dismissing the patient. It can mean taking digital images and radiographs of the patient. And whatever it is that you're doing with the patient, you want to always conform to OSHA standards. Also, because it's our job to protect patients and to protect ourselves and our coworkers, we want to always maintain good infection control. And so infection control measures are taken to protect the patients from contracting an infectious disease in the dental office, as well as your coworkers or yourself. All right, this is all for chapter 2. Please remember to do your reading for the entire chapter, and let me know if you have any questions. Thanks for listening.